Okay, so continue with the video. Uh, After elaborating differential, now start the risk factors. Okay, so ask about the cigarette smoking, alcohol intake, in some countries the prevalence of the esophageal cancer is very high, so you have to ask about the region or address of the patient. Okay, then in many European countries, because the European countries are well developed, so they um, usually consume canned food, store food. So this is also a risk for the esophageal carcinoma. Ask about consumption of canned food. And ask about the radiation exposure, corrosive ingestion by mistake, or and ask about the upper GI endoscopy. Ask about the drug usage, like if the patient is using NSAIDs or PPI over the counter. So these are also risk factors for the esophageal carcinoma. And also ask regarding any previous upper GI surgery. So these are the risk factors for the esophageal carcinoma. Then continue with the history, comes to the systemic review part, in which you have to elaborate every system of the body, like CNS. Start with the CNS from top to bottom. So start with the CNS, ask about the headache, blurring of vision, fits, altered level of consciousness, any sensory or motor disturbance. Then come to the CVS and ask about the tachycardia, palpitations, dyspnea, tinnitus. Then the respiratory system, ask about the dyspnea, hemoptysis, voice change, cough, repeated chest infections. Then to the abdomen, or you can say GI. Ask about the abdominal pain, hematemesis, melena, jaundice. Then the musculoskeletal system. Ask about the bone pain, backache, radiculopathy. So these are the questions you have to ask in the systemic review. Then come to the personal history. Ask about the sleep of the patient, sleep pattern, and appetite, and micturition, and bowel habits, and weight loss, and also the addiction. If he or she is addicted to alcohol, smoking, or anything, so ask about these things specifically. Then comes to the past, medical, surgical, and drug history, and also the transfusion history. Ask about the diabetes mellitus, hypertension, any joint pain for which he or she is taking an NSAIDs, and surgical history also, any trauma history, and ask about the drugs, like what drugs he is taking currently or he used to take in the past. Ask about the transfusion history, and come to the next part of the history, which is if the patient is female, ask about the gynae and obs history. Whether she is married or unmarried, currently menstruating, to ask about the menstrual cycle, last menstrual period, or if the patient is menopause, so ask about the date or year of the menopause, and come to the socioeconomic history. Like where he reside, number of rooms in the house, number of people in the house, either it's well ventilated or not, number of pets in the house, and are they using tap water or bottled water, or you should ask about the earning members in family. So you have to ask these questions, the socioeconomic status. Then ask about the immunization history, whether he or she is vaccinated up to date or not. Then family history. One question is very important: family history of carcinoma. This thing, carcinoma in the family. Ask about the esophageal, gastric, breast, ovarian, thyroid, prostate, and uterine carcinoma. And then occupational history. So here the history of the dysphagia is completed. So if you have any questions or you want to add some more questions in the history, so just comment in the video, so we will discuss further. Thank you.